Hello and welcome to another presentation brought to you by the Arouca SDA Church Health Department and presented by Katie and Knight's Diet. And the topic that we will be looking at today is scientifically proven natural remedies for hypertension. First, let me share an advisory with you. The following presentation is not intended to be a substitute for seeking medical advice and care as it relates to hypertension. Persons who have been diagnosed or believed to and believe that they are hypertensive should seek medical attention from a registered practitioner. This information is really geared towards assisting individuals to understand the medicinal benefits found in certain foods as it relates to hypertension. There are many actions and lifestyle changes that can be undertaken to aid in the treatment and management of hypertension. However, this presentation will focus on food, as this too can aid in the significant way to treat and manage hypertension. So we'll be looking at natural remedies in regards to food. But please note, this presentation is directly linked to the previous topic, which was medical treatment of hypertension. The link has been added here for you so that you can go back and review that so you are able to follow this presentation more accurately. So let's get started. We're going to look at a quick review of hypertension and we know that hypertension speaks to an elevated blood pressure and a consistent elevated blood pressure for those who are diagnosed as hypertensive. But there are 5 factors that influence what blood pressure readings are. And one, it would be cardiac output. This speaks to the amount of blood flowing from the heart whenever it contracts. Peripheral vascular resistance or compliance, which is the ability of blood vessels to expand to accommodate increased volume. And then volume of circulating blood. How much is available in the system? Viscosity of blood. This is the measure of the thickness of a fluid, and in this case, we're talking about blood. Or resistance of a fluid to flow, how easy or difficult it is to flow. And blood is 5 times more viscous than regular water. And you can do this test. You can look at oil as compared to water. How easy or what resistance is there with a fluid as it flows? And of course, elasticity of blood vessels. How elastic or what is the stretching capacity of these blood vessels before it gets to breaking point? So these are 5 factors that you must keep in mind as we look at some natural remedies and how they influence any of, or if not all of these specific factors. A quick review for those who did not get to listen in on the previous lesson presentation. So it spoke of the medical or medicines used for treating hypertension, and 5 were indicated. So I'm going to briefly just mention those. Angiotensin converting enzyme inhibitors, and these are given to patients to reduce blood pressure by relaxing blood vessels. And I want you to pay attention to the relaxing of blood vessels. Then there's the angiotensin 2 receptor blocker. And these are similar, of course, to the ACE inhibitors. And again, they help in that relaxing of blood vessels. And therefore, they're often used when the effects of angiotensin converting enzymes, the side effects are a bit troublesome. Then there's the calcium channel blockers, and these work to reduce electrical conduction within the heart. They decrease the force or the work that the heart muscle must do. And it also helps to dilate arteries. Then we have diuretics. Diuretics work in aiding the kidney to flush excess fluid from the body. Remember, one of the things we spoke about earlier is the volume, the amount of liquid or fluid rather that is available and that is forming the blood. So when there's excess, that can push that blood pressure up. And then there are beta blockers that cause the heart to beat slower and with less force. In other words, they help to lighten the work of the heart. Also, it helps to widen veins and arteries. So these persons who are hypertensive or who may have some sort of cardiac issue usually would be placed on one or a combination of these medications. So let's look at foods which are scientifically proven to carry out one or more of the same functions of those hypertensive medications. And we're specifically going to look at herbs, vegetables, and fruits. The first thing we're going to look at is garlic. And I can see some of you smiling because we know all too well that our parents and grandparents would have said to us, if their pressure is high, bring them some garlic tea, crush 2 garlic and put it in some hot water and bring it for me to drink. And we would find that the blood pressure will come down. But let's see how that actually works. The active ingredient here is allicin. It's with the garlic plant, it has a system known as the allicin-allichinase system, which is responsible for the production of allicin. Now, allicin is a sulfur-containing natural compound with many different biological properties, and is responsible for that typical smell and taste when we crush the garlic or cut it. It's a natural product which is consumed widely by lots of cultures all around the world. And it is a physiologically active molecule with many potential health benefits. But let's look at how it works in terms of the blood pressure. You see, it helps to modulate the epithelium, that's the lining of the blood cells, of the blood vessels rather, helping them to relax or contract. And this directly would affect the blood pressure reduction. Specifically, garlic has been shown to stimulate vasorelaxation or causing blood vessels to relax. Again, that brings us back to some of those medications we spoke about, like your ACE inhibitors, etc., that causes vasodilation and relaxation. In addition, it is reported that garlic reduces the production of the constricting factors endothelin-1 and angiotensin 2. And again, I bring you back to remember that drug that your doctor would give you, angiotensin 2 receptor blockers. So garlic has the ability as well to reduce the production of these 2 particular enzymes. Let's look a little further. Garlic has a blood thinning effect. And with that, it helps to decrease the risk of blood clotting and causing thrombosis. And this is important because we spoke earlier about the viscosity of blood and its ability to flow freely. And the thicker the blood is, the more resistance you get and the more difficult it is for it to move, giving the heart more work. So garlic in itself will help with that, keeping the blood viscosity in a way that the heart doesn't have to work so hard. So we get that double barrel effect with garlic. There are several studies that are out there that speaks about the effects of garlic. I'm just mentioning one that was done. And the results of that, as you see here, shows that after treating with garlic, the effects show that there was a reduction in blood pressure of 8 to 10 millimeters per mercury for the systolic blood pressure and 5 to 6 millimeters per mercury in the diastolic blood pressure. And that's awesome. So garlic lowers the blood pressure. That's where you can find the link for these. And at the end of every slide, you would see, you can go ahead and have a look and read up in more detail about what these studies show. So one of the things that garlic has been proven to do in lowering the blood pressure, as we mentioned, it affects the endothelium and causes that vasodilation. It inhibits ACE, which causes constriction of blood vessels, and it helps with decreasing peripheral resistance because of that blood thinning effect that it has. And all of these help to decrease blood pressure. It helps to limit injury to the endothelial lining and demonstrating great antihypertensive properties. So the next time someone's pressure, they've done the pressure and it's a bit elevated, and granny or mommy says, bring some garlic, and go right ahead. We must consider the side effects, however. Because of the very properties that garlic has, we have to be careful that because it can cause, there is the risk for increased bleeding in persons who may have such a condition or who may be taking blood thinners otherwise. So it's advisable that you let your doctor know and you observe to ensure that you're not seeing any signs of that. As well as garlic has the ability to cause skin irritation when applied to the skin raw like that, and sometimes even to the point where it may seem as though there is a burn. So be very careful with garlic as it gets in contact with the skin. The next one we want to look at is our green leafy vegetables and beetroot. Another interesting one. So what's the active ingredient here? It's nitrates. Studies suggest that eating foods rich in natural nitrates can help to reduce your risk for a number of chronic health conditions. However, please note that eating foods high in added nitrates, which is the difference. Added nitrates can be some cause for health risks. Example of this would be foods such as meat when nitrates are added to it. We're really talking about nitrates in your fruits and vegetables here. Now, vegetables account for 80% of the total nitrates consumed in most populations. The majority of them, these coming from the green leafy vegetable category and beetroot. There is now consistent and convincing evidence that an increase in nitrate-rich vegetables can result in a decrease in blood pressure within hours of ingestion. So nitrates, what are they? They are, guess what? Vasodilators. That means they help the blood vessels to dilate or widen. And as they have a direct effect on the vascular smooth muscles of the blood lining. Therefore, improving blood flow and allowing more oxygen-rich blood to reach the heart with a natural response to the fact that the blood vessels are easily dilated when we eat our green leafy veggies. They help to ease the workload of the heart. And one of the things that we looked at before was in terms of medications, we have that group that causes the heart to beat slower and reduce the workload of the heart. Well, guess what? Our green leafy vegetables, because of the nitrates in there, has the very same result. So there's so many studies that you can have a look at and go and do your own research. However, I just want to mention the study by Webb et al. In 2008 that's postulated that nitrates were one of the bioactive substances in vegetables responsible for cardiovascular benefits in having a plant-based diet. And then again in 2013, the same group of individuals went on to study 16 legible studies, and they cross-examined them as it relates to beetroot. And the studies showed that blood pressure was verified that blood pressures there's a reduction rather in the blood pressure after having beetroot. And the figures show that there was a reduction of 4.4 millimoles per mercury for the systolic pressure and 1.1 millimoles per mercury for the diastolic blood pressure. And this is just one of many studies. But I must warn you when you are having your green leafy veggies, because for the most part, we have them raw in salads and very mild cooking, if at all, we have to ensure that we wash them thoroughly because they can contain harmful bacteria based on the way that they're produced and grown. So you want to be careful with that you wash them well. And remember that you must consult your doctor if you are taking blood thinners otherwise, such as warfarin, etc., because green leafy vegetables can counteract their effects as well. So we want to look now at one of my favorite fruits, bananas. I really love bananas. So what does banana have in it that is so beneficial to controlling blood pressure? That would be potassium. Now, there are lots of other sources of potassium, and some of them are listed here. And I've put for your benefit a site that you can go to that will give you just about lots of examples of foods that are rich in potassium and how much potassium, etc. So potassium, like sodium, is an electrolyte. They work to help the body to maintain balances of fluid and blood volume so that it can function normally. However, consuming too little potassium and too much sodium can raise your blood pressure. And this is where the problem lies, because for the most part, most people tend to have very high sodium content meals. Most of the fast foods and ready-to-go meals are high in sodium. So we see that imbalance already, and we are all very familiar with the fact that sodium increases blood pressure. So how can we, treat with that? Studies have shown that potassium deficiencies not only increase blood pressure, but they increase your risk for heart attack and for strokes. So getting enough potassium is supposed to reverse that. So it's the other side of the coin. You see, potassium helps your nerves to function and muscles to contract. And if you think about your heart, that's all your heart is about. It's a muscle that is responding to a lot of nerve impulses and electrical impulses that keeps you going. It helps your heart beat to stay regular. So a diet rich in potassium helps to offset some of the sodium's harmful effects on blood pressure because of that sodium-potassium pump effect. A diet rich in potassium helps to offset some of those effects, as I mentioned before. Sodium relaxes. Notice again, here we go again. Sodium relaxes the walls of the blood vessels, lowering the blood pressure and protecting against muscle cramping. A number of studies have shown an association between low potassium intake and increased blood pressure and risk of stroke. So this is another study that was able to come to this conclusion. On the flip side, people who already have high blood pressure can significantly lower their systolic blood pressure by increasing their potassium intake when they choose to eat more healthy foods. And like I said, there's a lot of foods that are filled with potassium. And the idea always is to have a variety of foods that are natural. And therefore you would find yourself getting in all the required potassium that you need and nitrates, etc. So you may ask yourself, well, how can I possibly have low potassium if it's in everything, or if it's in foods that I eat naturally rather? Well, some of these things can cause you to lose potassium. If you had severe bout of vomiting and diarrhea, if you had gastro or something like that, if you're on a water pill, a diuretic, especially those that do not help to hold back the potassium so that you lose everything as you pass your urine, if you take laxatives regularly because you have issues opening your bowel, if you're anorexic, meaning that you don't usually eat well across the board, and in cases of chronic starvation or hormonal problems. So any of these can cause you to lose potassium. More often than not, persons who tend to lose potassium because of vomiting and diarrhea persons who may be on some sort of diuretic or water pill, as it is used, as it is called. But the opposite is also true in regards to potassium. High levels of potassium, also known as hyperkalemia, this is just as dangerous as low potassium levels. And it can even be deadly. Now, while symptoms can be similar for both high and low potassium, let's just mention what one may experience. There might be muscle weakness, irregular heart rhythm, and usually this is when most persons realize something is not right. And then if untreated quickly, there can be, unfortunately, one can experience cardiac arrest. And as it says before, it can even cause death. And that's because cells really have trouble responding to nerve impulses when there's too much potassium. This affects the muscle's ability to contract. And remember, the heart is that muscle that we're talking about. And if it can't contract, or if it's unaware of when it should be contracting and relaxing, then you can see why that could be very dangerous for you as an individual. So we've looked briefly at foods that have been proven to directly affect and reduce blood pressure and maintain good blood pressure in persons who may not be hypertensive. The Bible tells us in Genesis 1:29, and God said, "Behold, I have given you every plant yielding seed that is on the face of all the earth, and every tree with seed in it, in its fruit. You shall have them for food." So God is saying to us that he wants us to have our natural foods. Everything is in there for the maintaining and even healing of the body. In the book Ministry of Healing, Ellen G. White says, to care for the body by providing for it food that is relishable and strengthening is one of the first duties of the householder. So that's all of us. Carefully consider your diet. Study from cause to effect, and we've done a bit of that in this presentation. We've looked at things that go wrong, and we look at how food can help when things go wrong, or if used inappropriately, can cause things to go wrong. Cultivate self-control. Keep appetite under the control of reason. Never abuse the stomach by overeating, but do not deprive yourself of the wholesome, palatable food that health demands. It's all about balance and understanding how food works and ensuring that you do due diligence. My final thought: there are many natural foods available to us which also hold the same scientifically proven benefits in managing blood pressure as the ones highlighted in this presentation. And there's so many, many more. So I now challenge you to do the research, find out about them, then share them with your family, friends, and loved ones. As the saying goes, an ounce of prevention is worth a pound of cure. Remember, consult your doctor before making any changes to your hypertension management. Thank you for listening. Bye.